Ashwin, so lean into childhood obesity, food deserts, and how that sort of contributes to the health crisis in New York City, if you may.
Yeah, the many of the chronic diseases that we face as a society, as an American public, are, if not directly related, then influenced by our diets and nutrition. And so, when you have a generation of kids growing up obese or overweight, the majority of kids are overweight now. Um, uh, and the majority of kids are overweight or obese under 15. Once you um, hit those numbers, you put those young people at much greater risk of metabolic diseases like diabetes, hypertension, heart disease, and complications from that, let alone things that come as a result of carrying too much weight, like joint disease, and other forms of limited mobility over many years. So the choices we make in early childhood and in early adulthood influence the rest of our lives. And what's clear is that in New York City, in New York State, in across this country, that we don't do a good enough job of making healthy, fresh, nutritious foods accessible and affordable. We don't make the healthy choice the easy choice for too many people, and which is why we have communities that we refer to as food deserts, where you have to travel pretty long distances to access fresh, nutritious, healthy food. And or if you don't have to travel, it's unaffordable for you. It's economically unaffordable. So the city does a lot to sort of, whether it's expanding green markets or expanding SNAP benefits. There's a lot that the city does to try to combat that. But what's clear is we have so much more work to do, and we have to shift the economics of this also for grocery stores to come into the neighborhoods that need it the most, so that this becomes a routine part of culture, that fresh, healthy food and the time to cook it at home is a part of the culture. That sets a foundation for the rest of the life. But across life, we also know that activity is important, and that safe places to exercise, to participate in movement, safe spaces to ride bikes and to go to the park are really important. And again, so upgrading our park and bike lane infrastructure, particularly in those neighborhoods that need it the most, in neighborhoods that don't have subway access, those are really crucial things. And then, of course, the economics of healthcare. We need healthcare to be affordable and accessible, so that people can develop the habit of getting screened, getting checked, their blood sugar checked, their cholesterol checked, their blood pressure checked early, so that they can intervene early before it develops into long-term chronic illness. So all of those things taken together are really crucial. Last thing is to shift the economics of our city and to start talking about the combination of wealth and health. We
Mm.
know that low wealth families, and I don't mean wealth just as income, I mean like built up assets over time, right? Whether it's house, whether it's owning your own home, owning your own car, having securities or money invested in the stock market, having money invested into bonds. These are all things that are associated with better health, because it gives you the ability to withstand the normal shocks of life. If you lose a job, you don't automatically lose your insurance necessarily, right? If you have some reserve, you can go buy insurance on the marketplace, at least for a short amount of time. If you've got built up assets, you can deal with a shift in housing or something like that. All of these economic issues are the social drivers and economic drivers of health. So this is why health is such an important thing, and which is why, on the one hand, I'm encouraged to see health becoming such a focus with Make America Healthy Again. But I'm also discouraged by a lot of the policies that are coming out of there,
Yeah.
like cutting people's health care, focusing our attention on shiny things like seed oils and colored dyes, but not getting to the root of the ultra processed food epidemic, which is that we subsidize the production of cheap, unhealthy, crappy food, and then we send those out to the poor, some of the poorest communities in our country. What are we going to do about that as a policy? It's not a city issue alone, but what are we going to have that conversation, or are we just going to do the kind of weird stuff like talking about those things, or are we going to like start actually cutting things like mRNA research and dismantling our vaccine infrastructure and taking away healthcare? These are all things that don't make America healthy again. That's for darn sure. So, but I am a big believer in that health is a real unifying issue for people, for government, for public policy, because it's both an issue in itself and the byproduct of all these other things like economic policy, transportation policy, public safety, so forth. So that's a huge issue, and getting to our kids early and working on that obesity epidemic is crucial. Building those habits.
Ashwin, three proudest moments in city government.
Oh, I'm proud of the work we did on the COVID response overall. We, thousands of city workers mobilized with a single goal in mind: keep people safe, save lives, protect this city from this new threat. And I was proud to be a part of it. I was proud to be a beneficiary of it, right? I got vaccinated at a city site. I remember that day and that feeling of safety that I got. So I'm really proud of the response, even if there were challenges. I'm proud of it because I'm proud of public health and I'm proud of public service, and no one can take that away from me,
Right.
even if we have to reckon
Right.
with it. Number two
Right.
is our work on mental health. Our work on mental health, I was really proud of the work we did to things like expand clubhouses, to fight social media, and to declare it a public health crisis, to launch our lawsuit against the big companies, to expand access to digital mental health to teens. Our Teen Space program, which is ongoing now, I think it's approaching 30,000 teens that have been reached with licensed therapy as a result of partnering with the city partnering with Talkspace. And lastly, I'm very proud of Healthy NYC. Healthy NYC we passed it into local law, and it's very much a roadmap for how to build a healthier city. And it's the things we talked about, right? It's focusing in on preventable diseases, chronic diseases, diet, overdoses, mental health, cancer screenings, things that are low hanging fruit that we underinvest in. I think what people know is that healthcare is big business, right? Healthcare is this. You remember that movie from the 80s, The Money Pit with Tom Hanks? Healthcare is a money pit. You just can keep throwing money at it, and it's not delivering the outcomes we want because of the way in which we've set it up, right?
Hey,
So,
Ashwin, I take that as a compliment, by the way, that you think I wasn't around for Money Pit. That means
yeah,
I
is that
look young.
you and I know what, and we'll probably date ourselves. We'll date
I'm
ourselves.
aging well. Go ahead. I'm
Yes.
sorry. Go ahead.
We're dating ourselves for your listeners, maybe.
Yeah,
But I
yeah,
remember that movie, and
yeah.
and I remember that he couldn't get anything right, and he just kept fixing everything. And that's what healthcare is like. You just keep pouring money into it. We need to have a serious conversation on prevention and actually getting people
Got it.
healthy in the first place. The kind of thinking upstream that we've been talking about for the last several years. Healthy NYC is the roadmap. It's like the GPS coordinates for that. And the
Got it.
fact that we
Got it.
passed it into local law means that it hopefully won't just disappear with this administration. It will be a part of the way we do civic planning, like we do Plan NYC, or the climate plan, or any of the things that now have become a standard part of city service. I hope that Healthy NYC will be regarded like that because it really is the basis for building a healthier city over time.
Three do-overs. Three things you wish you would have
Oh,
done or done differently in your time in city government.
it's a great question. Um, Listen, I want to talk about things like mandates, not because I wish I
Mhm.
had done the mandate differently, or I wish I had not taken this one down or not taken this one down at the time that we did. We did the best we could with the information we had and trying to balance competing ideas. So I'm not here to question the mandates. I want to talk about the process through which we went about putting those in place and hearing people and engaging stakeholders and even the punishments for people who fell outside the mandates. I know it was super controversial to do things like, you know, take people's jobs away if they didn't comply. I know that was huge, or to like limit people's movement when the key to NYC was being
Mhm,
implemented
mhm,
under the de
mhm,
Blasio
mhm,
team. All those things are really controversial decisions. I wish there was a better way for us to kind of be measured in our response. I wish there was a way to, I think a lot of our decisions over this 5 year period at a very human level were driven by fear
mm,
because we were so traumatized by those early days of COVID. I think fear played a huge role in driving some of our decisions. And I wish at a broader level, I would have done two things differently. One is talk to more people, just really been out there engaging and just hearing people's concerns much more deeply than I did. I mean, I did in a general sense do that a lot, but on these issues. And then two, I wish we could have created multiple paths for people, ways to keep people safe and to kind of separate the people who weren't taking the steps to keep themselves and their communities safe without sort of putting such a strong economic punishment on them. I think that I wish there was a way we could have figured that out with more time. Um, yeah, that to me, those are two things I think about a lot. I think about our efforts to kind of like modernize our systems and
mhm,
how all the work that Doge was doing, if you can even call it work, it's just sort of like destroying
mhm, mhm,
government. but
mhm.
but I understand the impetus, right? I understand that kernel of impetus because there is a ton of inefficiency in city government and state government. There's a ton of waste, and the ability to sort of identify it and root it out is requires precision, requires real understanding of government, and it can't be done with a hammer, right? You need a scalpel. But I know that we tried to put in some of those changes into place during my time
Mhm.
in response to things like budget cuts or um, you know expiring federal funding because the we got a lot of federal funding for COVID and that was all going away. And I think the change management piece of that, I
Mm.
think I think I underestimated how hard that was going to be, right? Because I figured everyone would see it the way I saw it, which was everyone knows we're playing with house money during the pandemic. So all that stuff's got to either go away or we figure out a plan to keep it going, but you can't have both, right?
Yeah,
You can't have both. You can't keep the money and have things just continue as they are. Things are going to change. And I figured that that would be more easily metabolized by my
mm,
team and just by people around the city. And I saw myself and other commissioners really struggle with the process of taking things away from people in an environment where we had to, right? Where budgets and money was expiring. I saw some real challenges there, and I think I probably underestimated the hangover from COVID and how that was impacting people's responses. It's
mm.
not that they didn't understand. They understood that the money was going away. It's that they were still caught in this kind of like crisis mode and
Got
transitioning
it.
people out. By the time I left, and by my second and third year of my tenure, I felt like people had moved on. But in that first year, those transitions were really tough. One last regret. What's the last regret? I mean, look, I love public service, and I will always step up if asked for the city that I love, for the state and the country that I love. Um, but I talked to you earlier in this podcast about like seeing things through. There were forces outside of my control that prevented me from seeing some things through. So if
Yeah,
it's not so much a regret,
got it.
it's just that, if circumstances were better, I'd still be in my role, doing my job,
Got it.
right? And I'd be happy doing it, serving my city. But the circumstances were so volatile all around me on many fronts
Yeah.
that I was like, this, you know, as well, you know, I was called to try to help, you know, the vice president and try to get her elected. All these
Mhm.
competing demands real made me make the decisions I made, and it's not that I would do anything differently, but I wish those external factors were kind of not there, so that I could still be kind of doing my work, because I do miss it.
Doc, last three questions. What advice would you give a 21-year-old Ashwin?
Oh, great. That's a great question. Um, you got to stay open and curious. We are in a moment, so that's one. We're in a moment where people are just like shutting down, stuck in their information ecosystems. Um, you got to stay open and curious, and that means testing yourself and pushing yourself and talking to people who don't look like you, who don't sound like you, who don't think like you,
Mm, mm,
who may not share all of your values and your beliefs. The idea that you can't talk to someone who doesn't share your values doesn't compromise you in any way, to understand where people who are you may be misaligned with are coming from. But it does make you better at what anything you want to do, whether it's in government or in private sector or in just life. Hearing people, spending time with them, connecting with them on that human level. Number two is be yourself. Um, I'd like to think that I tried to be as authentic a leader as I could be. You know,
mm,
I'm not. I think you can tell. I speak the way I think.
mhm,
Um, I try not to censor myself, in the sense of like, I think sometimes people find that officials and elected and appointed officials speak in such um, constrained ways. Some of the constraints are necessary. Some of the constraints are self-imposed, and those self-imposed constraints I don't think are particularly helpful to building trust with people.
mhm, mhm,
And so cultivate the ability to communicate authentically, and to really that communication is a skill in and of itself. It's not just your expertise. You got to be able to persuade and communicate people. And lastly, figure out your why. Like, what is it you're doing this for? Who is it you're
mm,
doing this for? What is it you're doing this for? Right? When I think about why I do this work, and the images of people and moments in time that I have, it starts with my family, right? It starts with the years I spent um, trailing my mother around the hospital and getting to know what it looked like and felt like to change people's lives, and to have
mm,
people come to her years later after saving their baby from critical illness and say, look at how he's grown, look at how she's grown, it's thanks to you. That power, that responsibility. Or to look at my family in India. My uncle um, had polio as a child. He's paralyzed on one side. My aunt, his older sister, died from polio when she was a medical student. This is all pre-vaccine era, in the 50s, 40s, and 50s. And you know, it's very discouraging to see what the attack on vaccines now, and
mm,
that basic science. But I keep that in mind, though. I never want that kind of suffering to happen to anyone, because think about the ripple effects for someone like my grandfather. He lost two children in a short span.
yeah.
His pride and joy, his oldest daughter, first to go to school, first to go to college, studying to be a doctor, died suddenly. And his youngest boy, paralyzed, um, and injured from polio. He lost another child to drowning. It's this. I never want anyone to suffer those preventable things, because it has ripple effects throughout generations. Intergenerational trauma is a real thing. So never forget. And then I have patient stories from across my
Yeah.
life, working abroad, working here in New York City. You got to have those people and those places and those moments in your mind at
Mhm,
all
mhm,
times, because then it's your North Star. It's like, why am I here? So you're going to get pushed in all sorts of directions. You're going to have ethical choices, moral choices, strategic choices, scientific choices, whatever they are. You're going to have to make choices. And it's helpful when you're making those choices to have an anchor, a North Star in your head. And it's those people, those moments, and those people that impact you, that no one can ever take away from you. And so I encourage my 21-year-old self, or anyone getting into service or doing anything in life, to really um, have a clear sense of the why.
Last one. As a South Asian, what does the Zohran Mamdani, Assembly Member Zohran Mamdani, whether you agree with his politics or not, but what does that mean for you that he is potentially going to be the first South Asian mayor of the most important city in the world? Does it mean
Yeah,
anything for you?
it does.
And what is
Look, it is remarkable uh how he has come out of nowhere to kind of capture people's attention, and to do so in a way that's very human and authentic. I tip the cap to him on that level for running a great race so far, right? Um, Policy aside, politics aside, when anyone comes and asks me for help on the basis of my expertise or my experience or my knowledge or my training, especially in service of the city and the place that I love, where I'm raising my family, where I'm a New Yorker and will be for the rest of my life, uh, I will answer that bell, right? Because it's important. It's really important to serve the place that's giving you so much. And I say that very specifically in relation to the assembly member, because I've lived in all sorts of places, and my community has faced all sorts of challenges and marginalization, less than some, more than others, different, right? Just our own particular flavor of otherness. New York City is the one place in the world where I come and I stay and I feel entirely comfortable in my own skin. Like I wake up every day and I'm Ashwin and I'm a New Yorker and I'm a dad and I'm a community member and I'm just here. I go to other parts of the world, other parts of the country in particular, and I'm much more conscious of my identity, this color of my skin, the way that I look, not in New York. And that's a beautiful thing, right? That's a beautiful, beautiful thing that I can never repay. So watching someone like Zoran on just that very basic human level, I'm sure he feels similarly about the city as many immigrants do, which is that what a beautiful place where you can wake up every day and just be yourself without fear, without worry, without, I mean, other worries, of course, but at least on the
Mhm,
basis of just your identity alone.
mhm,
As a child of immigrants growing up in this country, I grew up in the Midwest, Chicago. I thought about
mhm,
my identity all the time, right?
mhm,
Because I
mhm.
was different. I had a funny sounding name. I didn't look like everybody else. I didn't know how people, and you know me, I'm a tall, big guy. It's not
Yeah,
like I take up space, and it was hard to hide,
yeah,
but there were
yeah,
many moments where I just wanted to hide, right?
yeah.
As a
I'll
kid.
tell you.
To just sort of be out there and be yourself. I tip the cap on that level.
Mhm.
And we'll see how things shake out, I guess.
I'll wrap with this. I mean, for me personally, right, regardless of how I feel about whatever, I feel proud. And I felt the same thing when Obama won, because I thought for a long time we weren't past it as a country, some of the history. And to see that he won and he won handsomely, not once but twice, speaks to sort of, it made me proud to be an American, and again, to some of the points you've made. And same with Zoran, that the fact that, across the board overwhelmingly, despite, you know, socioeconomic and right, ethnic and racial, and people sort of resonated with the messaging that affordability is something, and you highlighted
Yeah.
a lot of that in your conversations around healthcare and so forth and so on. But again, this is your time, Dr. Vasan. Anything you want to add that I forgot to ask you that you want to
Well, I
mention
mean,
before?
I just want to build on what you just said, right? I mean, what a beautiful country where this could happen, where these kinds of things happen, where
Mm-hmm,
President Obama can get elected, where a
mm-hmm,
Tammy
mm-hmm.
Duckworth can be a
Yeah, yeah,
senator from Illinois, where you just have these stories that aren't
yeah.
happening
And
anywhere else.
Zoran's an immigrant too. I mean, that's
And
the other thing.
Zoran, I give
Was not
again
born. He was not
th-
born in New York City.
those stories are uniquely American, and regardless of all the, frankly, the bullshit that's happening all around us,
Mhm. Yeah, it's fine. It's
you,
fine.
you know,
You
I
see
mean,
the bull behind me. I have the bull.
yeah, I'm fired up about it. But like, regardless of all this bullshit, people trying to redefine the American ethos for themselves. Here's my message. If I have a message, if anyone's listening, you don't get to do that. You don't get to define America for us because it's all of us that define America, and that's what makes it special. It makes these stories like Zohran and Obama and all these people remarkable and possible. Makes my parents' story possible. They came here with very little, professionals, yes, but no clear pathway, and they built up a life that they can feel proud of. Generations of people have done this. You don't get to change that just because of your backwards ideology, right? So I appreciate that very much. I will say now, and I think that having been a part of another administration as well, capturing, you campaign in poetry, you govern in prose. That whole old saying. What is that? Mario Cuomo, I think.
Yeah,
You
Mario
know,
Cuomo. Yeah, Hamlet on the
yeah,
Hudson.
that's right. I think he's right, but also you gotta show your work. You know, I think New York is powerful because its people are powerful and its institutions are powerful and the media is powerful, and that's a good thing, right? You have to have powerful ideas and you have to back them up. So subjecting ideas to scrutiny is par for the course. And if you aren't willing to, I think it's important that everyone answers the questions of like, how are you going to get things done? How are you going to bring these ideas to life? I think that's important. I think that you learned as much as I've learned in city service. These jobs are hard. The city is complex. It's diverse. There's myriad stakeholders. Executing on big vision requires skill, focus, follow through, and yes, the C word, compromise, right? And like we got to be able to talk about that in this most complex city in a serious way. Now, maybe that doesn't make for good. I'm no election expert and I've never run for office, but that may not make for good campaign poetry, but it damn well is deserved by the city of New York that people are able to kind of show their work and really back up their ideas. And I want to see that anyone running for anything in this city and state should have to be held to that litmus test, I think, you know?
Thank you. Thank you, Dr. Vasan, and hopefully
Yeah.
this won't be the last time we have this conversation because it was hella fun.
It was a lot of fun. Thank you, Roberto. Thanks for doing
Thank you
this,
so
and I
much.
appreciate the time.
Thank you.
Yeah,
Thank you,
appreciate you.
doctor. All the best. Enjoy your weekend.
Thank you. You too.